As 9/11 approaches its 7th anniversary, it's a fading memory to some, but for many it remains a day-to-day challenge. This includes thousands who lost loved ones, witnessed the events, or participated in the recovery efforts. Increasingly, federal and state officials are acknowledging a significant disease burden in these survivors which will last their lifetime. Physical and mental ailments are now beginning to be reported in careful follow-up studies. For example, the National Institute of Environmental Health Sciences, a branch of the NIH, recently published an article measuring the mental health and social functioning of World Trade Center rescue, recovery, and cleanup workers. Having closely followed over 10,000 citizens for 1 to 5 years, they found that 11% suffered from post-traumatic stress disorder, which normally is present in approximately 3% of the population. In addition, 9% were clinically depressed, 5% suffered panic disorders, and 62% had substantial stress reactions. None of this is news to the police or firefighters in New York City. They've been fighting an uphill battle for years, watching responders decline. 2 years ago, I attended a wake of a police responder who had committed suicide. His partners told me that he was not the first, and that there were several others physically disabled by the events and increasingly depressed by the prospects for their futures, who they knew would likely end up the same way. Their view was that public denial compounded the problem. Now that's changing. On May 7, 2008, Mayor Bloomberg and Police Commissioner Kelly publicly honored 11 police officers who had fallen in the line of duty. 8 of the 11 honored were reported in the press release to have died of a 9/11 related illness. That was a first. The challenge that lies ahead is not a small one. Official studies funded by the federal government and conducted at New York's Mount Sinai Medical Center predict problems for years to come. Dr. Robin Herbert, co-director of the hospital's program monitoring afflicted workers, told lawmakers in 2006 that new patients are still arriving at Mount Sinai to be treated for 9/11 related illnesses, and thousands probably will need lifelong care. And it's not just New Yorkers. The U.S. Department of Health and Human Services estimates up to 6,000 volunteer responders from outside New York need to be monitored as well. In February 2008, New York City announced a $100 million effort to stay on top of this crisis. Part of that effort is a new study in respiratory disease functioning of some 900 non-smoking New Yorkers exposed to dust-laden air tied to this catastrophe. Christy Todd Whitman, then head of the EPA, issued a press release on September 13, 2001, reassuring the public that the air around the disaster site was relatively safe. On September 16, 2001, Whitman noted that measurements of air contaminant levels, quotes, cause us no concern, close quotes. On September 18, 2001, she again reassured New York and Washington residents that their air and water were safe. That was then. In 2006, she stated, quotes, "We agreed then, and I reiterate now, that the air on the site was not clean. We were emphatic that workers needed to wear respirators, a message I frequently delivered. But I did not have the jurisdiction to force workers to wear them. That was up to their superiors," close quotes. So what was in the air? Well, pretty much everything that had been in 2 100-story buildings, but vaporized. That's why Representative Christopher Shays, a Republican from Connecticut, who chaired the hearing in 2006 on air quality post-9/11, said Whitman's September 2001 statements, quotes, "defied logic and everybody knows that," close quotes. Even if we were measuring the air and communicating those results properly, it's possible we weren't measuring the right things. For example, in May of 2008, in the journal Nature Nanotechnology, a study reported the effects of injecting nanotubes. These are micro-miniaturized, rolled-up sheets of carbon that may be of future use in electronics, and they were injected into mice. Nanotubes are not yet in common use, and there has been controversy over their safety. This study revealed that mice exposed to the substance responded with cancer development in the same way as when exposed to asbestos. Asbestos-laden dust, when inhaled, draws a response from protective macrophage cells, which attempt to ingest the particles and remove them. The asbestos fibers are too long to remove. They become stuck in place and ultimately form tumors around them. What exactly was in that air, and why exactly are some people more vulnerable to mental problems and other issues? We may never know the answer to those questions. What we do know is this, that large numbers of Americans developed chronic diseases from direct exposure to 9/11. That adequate protective measures were not taken by those involved at the site. That significant ongoing support will be required for many years by those affected, and that denying any of the above simply adds to the disease burden of those afflicted. We could do much better. For Health Commentary, I'm Mike McGee.